Hello guys, how are you today? We're talking about that insurance in USA. How does the USA health system work? Healthcare is the United States is organization in complex bureaucracy while in the research of the world healthcare facilities are owned mostly by government by private sector business in USA. Large share of hospitals and clinics and are owned by private non-profit organizations. The United States is the country that has highest healthcare expenditures in the world. While these expenditures are covered in the large share by public payers are as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations in the USA, health system does not provide health care to its entire population as there is no signal nationwide system of health insurance. The United States primarily relies to employees who voluntarily provide health insurance coverage to their employee and dependent. In addition, the government has programs that tend to over healthcare expenses for the fragile part of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to getting health insurance in the USA is not a easy thing. Someone may think that once you have money, everything in easy paise, but in fact things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in USA. It is optional but highly recommended and necessary since health services are very costly, more than in any other countries over where across the global. There are two types of health insurance in the USA, private and public. Most people use a combination of both. The USA public health insurance are Medicare, Medicaid and Children Health Insurance Program. The US has the most expensive healthcare in the world. That by getting adequate health insurance coverage more come highly recommended. You can get a free US health insurance quote at in Subway by clicking here. Click here to view the GeoBlue health insurance plan at International Citizen by click here. Medicare. Medicare is a national health insurance program that date back to 1966. It provides health insurance for USA nationals older than 65 years old, but also of younger people with end-stage renal diseases, ALS, and some other disabilities. Data shows that in 2018, Medicare provide almost 60 million individuals with health care in USA. Over 51 million of were elder, which were elder than 65. The Medicare program is divided into four parts. Part 1, which covers hospital skilled nursing and hospice services. Part B, cover how out party patient services including some provider services while inpatients at hospital operation hospital charges. Part C is an alternative called managed Medicare, which permits patients to select health plan with at least the some services coverage as Part A and B, often the benefit of D, and an annual out-of-pocket spend limit which A and B lack. To sign in this part, one must sign in Part A and B first. Part D covers mostly self-administered prescriptions drugs, medicine is a federal and state program that help people with limited income and resources to cover medical costs while covering benefit normal not covered by Medicare or nursing home care or personal care services. In the largest source funding of medical and health related services of people with low income in the United States. So, well, that's all for today. We meet in the next video with a new topic. Okay, bye.